3:26 in the morning. Airport staffing issues continue to disrupt travel across the country. The FAA's website shows ground stops and delays possible today at several of the country's major airports. According to FlightAware, over 3,500 flights were delayed yesterday as air traffic controllers are being forced to work without pay during the government shutdown. The FAA reports major hubs in Atlanta, Boston, Chicago, Dallas, and Houston all have had problems with staffing. There also was a brief ground stop yesterday at Nashville's International Airport, delaying flights there by an average of 2 hours.
As for the shutdown, 8 days in and still no end in sight, Democrats still demand action be taken now on tax credits for Obamacare premiums. Speaking on the Senate floor yesterday, Democratic Senator Patty Murray of Washington outlined the 10 states that will see the highest increases in health insurance premiums if ACA tax credits expire. In the top 5 states, which include West Virginia, Wyoming, Alaska, Tennessee, and Mississippi, premiums will more than quadruple. Premiums are also expected to more than triple in other states, including Texas, South Carolina, and Alabama. All 10 are considered to be red states. That's perhaps explaining why Republican Congresswoman Marjorie Taylor Greene of Georgia doubled down yesterday on her break with GOP leadership over health care subsidies amid the government shutdown. Greene slammed her party, claiming Republicans did not have a plan on health care, arguing the GOP should be working to fix the problem now instead of using the issue as political leverage. Greene criticized the GOP's lack of action in an interview yesterday, saying in part, quote, when it comes to the point where families are spending anywhere from $1,500 to $2,000 a month and looking at hikes coming on their insurance premiums, I think that's unforgivable. The far-right congresswoman broke with the party on Monday after posting on social media that her adult children who are covered by the Affordable Care Act will see their premiums double if the issue is not addressed. House Speaker Mike Johnson pushed back yesterday when asked about Greene's remarks regarding the health care issue at the center of the shutdown.
Congresswoman Greene does not serve on the committees of jurisdiction that deal with those specialized issues, and she's probably not read in on some of that because they've still been sort of in their silos of the people who specialize in those issues. When we get the conference back and when everybody's back together, we'll go through a lot of that. I mean, I've spoken personally to a number of members in the last 3 days, Republicans, from the most conservative member to the more moderate member, with their various ideas on that. There's a lot of work that's been done on that. It's implied as if this has been some sort of ignored issue. It's not that at all.
Well, then what is it? Greene fired back, claiming Johnson has not reached out to discuss her concerns. J. Mart, there's an accusation that the Republicans are using this for political leverage. What's the leverage of people having skyrocketing insurance premiums?
Yeah, look,
I don't understand it.
I think they want to fix the issue of the Obamacare premiums. They don't want to do it, though, in a way that is seen as sort of caving to Democratic demands. So there's this standoff, but it's a lot of theater. I think when the government does come back, there's going to be some kind of a fix on those premiums, precisely, Mika, for the reasons that you laid out on the screen, because all those states that are the hardest hit are all red America and all have GOP senators. But what MTG did there was hand the Democrats a gift yesterday. Hand Republicans a gift because it shows the lack of unity in Republican ranks on the issue. And that obviously is a huge help to Democrats right now. Also, don't forget Trump yesterday saying we're not sure if folks are going to get back pay after all, which is devastating to federal employees who are counting on that back pay.
Unbelievable.
Military,
too.
A lot
of them don't deserve it, he said, federal workers.
Which is totally off message here. So I thought yesterday was to date one of the best political days for Democrats during the shutdown, because you have MTG breaking ranks on health care and then Trump doing his Trump thing, which is totally off message.
Yeah, and not giving back pay, that would be illegal. Like, that would be illegal. Let's not gloss over that. Let's not gloss over that. And certainly to this point, the president has not followed through on their threats to the mass firings, the Ross vote firings. Again, there's questions about the legality of that either, but to this point, he's held that off. Ali Vitale, I don't think we should say Marjorie Taylor Greene, welcome to the resistance, but I do think that we are seeing moments here, a few cracks in the Republican facade. There's been reporting last night. I've talked to folks on the Hill, and I know you're so well sourced there, that there's a little bit of uneasiness that Trump, Thune, Johnson aren't totally singing from the same hymn book anymore in terms of how to do this. And mostly it's because the Democrats, the pressure they're putting in on health care, on these subsidies, seems to be working.
Yeah, I do think that it's working, because the way that I see it, as much as votes aren't moving from, yes to no or vice versa, what has moved is this debate over not if health care should be negotiated at this moment, but when. That's the debate that lawmakers are actively having right now. Republicans are saying it's after the shutdown. Democrats are saying it has to be right now. That is moving the Overton window, and that's because Democrats held their leverage on this. When it comes to the Marjorie Taylor Greene of it all, I did have a Democratic staffer joke with me yesterday. What do you mean? We've always loved Marjorie Taylor Greene. I mean, I do think they are feeling a little bit of the political whiplash, but what she's saying tracks with the polling that shows that nearly 7 in 10 Republicans want to see ACA subsidies negotiated here, and that health care is a broader issue of concern that doesn't just tack between the typical party lines. I think that's really important, and it goes back to something that I asked the speaker in my interview, which is something that all of us know so well. I do think that there's a possibility that Donald Trump, in his constant quest to make a deal, sees the political daylight on this more quickly than lawmakers on the Hill, and ultimately says, yeah, we're going to do a deal on this, and kind of sells them out. And so I asked the speaker, would you work against the president if he said, I want to do a deal on ACA subsidies? And of course, Johnson said, well, that's not really the question at hand right now, but it kind of sounds like it's getting to the point where it is.
Yeah, which is why when...
Yeah, I was going to say that this is why the Republican leaders in Congress were so concerned about Trump meeting privately with Democrats, because they knew if Trump was in the room alone with Schumer and Jeffries, he'd sign off on whatever deal that they offered. And that's why they desperately wanted Thune and Johnson in the room for adult supervision with Trump.
Katty Kay.
Sorry.
Yeah, no, but it gets also to this question of affordability, which is what the Democrats, whether it's in the New York mayoral race or around the country, know that they can run on. I think that's why Marjorie Taylor Greene's tweet was so telling, is because you have so many Americans. My adult kids are in the same position. They have their own health care through the ACA. If these premiums are pulled, then if these credits are pulled, then their premiums are going to go up too. So I think that is something that really resonates around the country, and you get the sense that Republicans are now feeling that, because it's not just a health care issue, it's part of this affordability issue that so many Americans are faced with.
And for Marjorie Taylor Greene, Mika, this is just old-fashioned constituent services. Her constituents benefit from the Affordable Care Act. They are going to lose coverage or see their premiums double or quadruple. She's looking out, and we all have our problems with Marjorie Taylor Greene. In this case, she's looking out for her constituents.
And Jay Moore pointing out that yesterday was a great day for Democrats, and all they had to do was go like this. Because the wins were just the behavior on the Republican side, the choices being made here. And honestly, the threats of yanking the pay from federal workers, yeah, Democrats can just sit there and watch that happen, because that would be devastating politically. I don't get it, but we will follow it and see where it leads us. MSNBC senior Capitol Hill correspondent Ali Vitali, thank you very much. Senior political columnist at Politico, Jonathan Martin, thank you as well.